Today I'm going to talk about sickle cell and mental health. Living with sickle cell disease is hard. You learn for a very young age to deal with pain, fear, and so many broken dreams. The everyday experiences of childhood can become traumatic triggers. Things like cold wave, heat wave, or physical activity like swimming or playing soccer to attending a social event like a birthday party. And when a crisis is triggered, it can end up in hospitalization that will require multiple injections for the treatments. Dealing with sickle cell means so many physical symptoms like fatigue, anemia, tissue necrosis, bone necrosis, leg ulcers, difficulty breathing, fever, and so many other complications. And with the absence of treatment to deal with the sudden crisis, the only effective pain medication are opioids. Now, what parent doesn't stress to know that their child is on opioids? They are not only highly addictive, they are also very difficult to get during a legitimate crisis due to the stigma that comes with the use of opioids. So at any age, all these factors can lead to crippling, lifelong mental health issues. And you have to think about somebody going through their whole lifetime dealing with all these issues and not getting adequate care or adequate support. Of course, it's going to affect them. But this is just the tip of the iceberg. If we dig deep inside to see a few quality of life issues, what does living with sickle cell really looks like? It means not able to finish school or attend advanced education, which also means not having access to health benefits or limited health benefits. Now, how do you ration your sick days if every day is a sick day for you? How do you get a better job when you have to stay close to the limited numbers of treatment centers to have access to care? How do you meet people? How do you have a partner, potential partner, if you are often at the hospital or you can't go out because of the change of the weather or because you're simply too tired? How can you be self-sufficient when you need to have a strong network of family or friends to survive? And how do you cope with the fact that you can't attend your child's school play or help them with homework or even their soccer play? Or how do you feel when the family has to cancel their vacation or have to suddenly cancel any program they have because of you? We often focus on the big issues of the treatment, which of course are important, but we forget about the fact, the impact of mental health on these issues that keep adding up day after day, month after month, years after years, crisis after crisis. And they're being ignored. Throughout the lifetime of a person living with sickle cell, the impact of mental health is debilitating, profoundly. For caregivers like me, it's heartbreaking to watch. You often ask yourself, how can I help my child? What can I do? So it leaves us with feeling of anger, frustration, and helplessness. No parent is equipped to deal with all this. We know we must stay both mentally and physically healthy to deal with sickle cell, but there is a pitiful lack of resources to support us in this. Healthcare, time, social, financial, network, everything. Where is the support when you are even handed the diagnosis of a child living with sickle cell, chronic illness, a lifetime condition? None. So over the years, for me, a few things have worked to help me support my mental health so that I can help my child. And they can be wrapped around 4 things. 1, acquiring, enough information to self-advocate. 2, the process of accepting the reality of the condition. And 3, asking for help. And 4, being kind to yourself, being kind to myself, self-care. Dealing with sickle cell requires, resources, both human and financial. But the most important thing is that you must take care of yourself. I focus my thinking on this, that a child mental health is supported by the parent's mental health. So you are the role model for your child. So I had to make sure that I was always both mentally and physically fit so that I can help my child all the time. So let's take action. Let's start the conversation about mental health, and let's actually have the conversation and take action. We need to change things for ourselves. Nobody's going to fix it for us. And we have to drive the agenda for a better mental health together as a community. Thank you.